And we're hearing from doctors that some healthcare services are being hit by airstrikes, including the maternity children's hospital run by the medical charity Syrian American Medical Society, or SAMS. The society says it had to recently evacuate U.S. doctors volunteering in northern Syria due to the escalating violence. Right now, I want to bring in Dr. Bachir Tajaldin, the Turkey country director at the Syrian American Medical Society. Thank you for being here, doctor. I really appreciate the time. Can you just explain the nature of what you and your group have been doing in Syria and how maybe that's changed in recent weeks?
Hello, good morning, and thanks for this interview. Actually, Syrian American Medical Society is a medical organization based in the U.S. and established by Syrian American physicians who have the dual citizenship in the U.S. It has over 1,000 of volunteering doctors leading the organization, participating in the healthcare in a humanitarian context, most obviously in Syria. Me and my colleagues are providing health services in northwest Syria. It's in a very challenging situation through a network of about 40 health facilities distributed between Idlib and Aleppo governorates. We are covering the humanitarian needs and essential needs for the population. We were accessing about 5 million population in northwest Syria during the last couple of years. Last week, we had our medical mission consisting of about 9 volunteering U.S. doctors were providing services in northwest Syria and Idlib, but due to the escalation and starting of the military wars, we evacuated them and ended that mission. And starting from Friday till now, actually, it was a very challenging situation, as now SAMS, among other healthcare providers, other NGOs, have access to more than double of the population last week. So this week we have to deal with a lot of population who have been also deprived from many of the essential services, including clean water, food, and also essential health services during the last decade. I was in Syria, in Aleppo city, during the last week. Met with my colleagues, with the community, and actually there are a huge lack of the essential health services. The people who have the non-communicable diseases or the chronic diseases like hypertension, diabetes, yes. Cancer patients don't have access to the health services. Even the women who have to give birth, they don't have access to the hospital, so they have been referred outside of the city, and all the road from the city to the to other governorate were really very crowded with the ambulances who are referring patients outside of the city.
And doctor, I just want to jump in really quickly, because I want to ask you about some of what you were talking about, because you know, I saw your post on Facebook where you spoke, you posted pictures of you in Aleppo and spoke of the indescribable feeling of meeting your city, your family, your home, the places where you studied. Can you try to describe what those places have meant to you over a period of war where we've seen 300,000 people killed and millions of people turned refugees in your country? I mean, what has it been like being there throughout all of this?
Actually, at a personal level, as a Syrian medical doctor who have completed my internal medicine study and certificate, like many of my colleagues and physicians and other health care workers, unfortunately, we were dealing during the past years with the government or regime who has polarized the population. You cannot even provide the services impartially to the population. So whenever you are providing services to any geographical location out of the control of the country, you are identified as an enemy. We lost a lot of our colleagues, our friends, our classmates. Either they have been killed or arrested. Personally, I left Aleppo since more than 13 years and 6 months, and I lost the physical communication with my father, with my family. So when I went to Aleppo city, I saw my father after 13 years and 6 months and 8 days. I was counting them by hour, actually. So it was very heart-touching feeling. I went to my old places, my the city in the city, my old house, my schools. Unfortunately, one of the very sensitive and very concerned that I had seen that one of my schools where I did in the elementary schools, and also the medical school and the university hospital who I have learned and trained in, they both have been attacked by airstrikes, and they have been damaged. The most important thing also, I met with the population, with the people, with the friends. They have very pale seeing faces. They are losing a lot of their freshness during the last decade of the deprivations. But also the feeling with the population and the inhabitants in Aleppo city and other cities in other elsewhere was the fear. They were afraid that there will be a revenge attack on the civilians and the civilian infrastructure, and that unfortunately happened last Sunday when the Aleppo University Hospital was targeted directly by an airstrike, and that prevented healthcare workers to access to the hospital in addition to the beneficiaries.
And I think to use your words, Doctor, I heard some of your comments at a conference earlier this year. You said attacks on healthcare are a tragic hallmark of the Syrian conflict. And Doctor, I'm sorry I have to leave the interview there right now, but I really appreciate you coming on and sharing what you've seen. Dr. Bachir Tajaldin, the Turkey Country Director at the Syrian American Medical Society. Thank you so much.